So if we take a look first at CBT, we know that one of the most recent studies looking at efficacy of this intervention for the treatment specifically of pediatric DGBIs is from this group that you see. They looked at 33 randomized controlled trials that were focusing on either CBT or hypnosis. And it was determined that in comparison to a group that received no treatment, incorporating CBT into a patient's treatment plan not only resulted in higher levels of treatment success, but also lowered frequency and intensity of pain symptoms. And today, what we know is that studies have confirmed that CBT can actually be offered in multiple ways, including traditional in person treatment that one might think of when coming to a psychologist, and now in the era of COVID, using telehealth. It's been suggested also, even that offering CBT only to parents and caregivers or to patients and their parents, given the influential role that they play in the lives of pediatric patients and how the parents' coping styles can impact the child or adolescent symptoms, is also an effective mode of delivery. So there have been a number of randomized controlled trials looking at the effectiveness of using what we call that traditional in-person CBT with patients diagnosed with DGBIs. And the majority of the studies have included a population of patients who are diagnosed with either functional abdominal pain or irritable bowel syndrome. And the findings from these studies demonstrate that in comparison to control groups, who oftentimes receive standard medical care, patients who received the intervention of CBT reported a decrease in symptoms and things like a reduction in school absences as a result of their treatment.